Meadowcroft PICU essentially is a 10-bedded PICU ward, always been, and it went through renovation and quite substantial change in the layout of the ward itself. So basically we ended up with a space where it was more of a chill out room for our patients if they needed time away from the other patients on the ward.
The whole aim and purpose of this room is to provide privacy and dignity for a patient while they're in distress. It's a PICU, and most time patients are in distress. We don't want them to be together in distress, so it's like to provide the privacy and dignity and some time that staff can spend with them and speak to them about what causes the problems, and we can see how we can help it.
The sensory room has been used since August 2015. We're currently gathering data in order to evaluate the effectiveness on reducing the distressing symptoms of psychosis. All the staff at Meadowcroft are involved in the project, including occupational therapists, nurses, healthcare assistants and activity workers. Complementary therapists also use the room for treatments as well.
The expected benefits in regards to service users, carers and families are that we hope to provide a more positive experience of interventions within a PICU setting. It's a more effective way of de-escalation, which we'll be able to measure through our patient satisfaction surveys. It will look at improving symptoms of psychosis and agitation, and we're using the BPRS as an outcome measure for this.
It also kind of like helps us assess how we're managing with incidences of violence, disturbed behavior on the ward. And so for the feedback we are having, because it's in its early days as well, so we're getting quite constructive feedback from the service users as how we can develop it into a more male PICU sensory room.
In the longer term, we'd like to look at publishing a clinical study on the effectiveness of the room in terms of de-escalation, relaxation and preventing incidents of violence and aggression.
We'll also be looking at the sickness and injury of nursing staff. Hopefully we'd like to see that drop, basically because we wouldn't be using physical intervention as much along with rapid tranquilization.
And the last thing we would like to do is to present our research next year at the PICU Annual Conference 2016.